So leo hii tuko kwa International Day against drug abuse and illicit trafficking. And before I read my speech, nataka nishukuru Governor Mheshimiwa Abdulswamad. I think I've got it right, yeah? Abdulswamad Nasir, for the support and the partnership that you have had with NACADA, but also most importantly, with the national government. That when we talk about universal healthcare, you cannot have a conversation on universal healthcare without first talking about Mombasa County, because you lead and others follow in every respect. And today, when we talk about rehabilitation, you've made it possible for the residents of Mombasa County, particularly those who've had challenges with drugs, that it is now possible because they are members, they are registered with SHA, and SHA is able to pay for their rehabilitation. And I want to also commend and appreciate you for the offer to pay the premium for those who have not done so that when they come to this facility or any other facility, including the ones that you run as the county government of Mombasa, they can be able to get the services and the support that is required. Again, I want to congratulate and appreciate my brother, Buddy Twalib, that you've made it possible for us to easily access this facility through your intervention as the MP of the area, but also most importantly, as a member of parliament, you've supported us in budget appropriation, and that is why this facility is in the state that it is today. And I want to appeal to you that we continue with that support, because if you look at the master plan that we have for this facility, there is still more work that we need to do. And we will work together and assure you that the resources that is made available to us will be able to deploy them in the best way possible. And I also want to appreciate members of the community and those who have gone out of their way to support vijana wetu kwa hii mambo ya rehabilitation. And Senator Miraj spoke about, I don't know, kama ni Amina, and then there were other names that let's appreciate them for the work that they have done to keep our society together. So it's my pleasure to join you today as we commemorate the International Day Against Drug Abuse and Illicit Trafficking, the IDADA 2026. This is a day that is set aside globally to reaffirm our commitment in addressing one of the most serious public health, social, economic, and security challenges that we face today in the world. That is drug abuse and illicit trafficking. And just as I've mentioned, yesterday we had our Border Control Operations Coordinations Committee meeting. And one of the issues we were discussing is on issues of how we can contain illicit flow of drugs, that there are business people who benefit out of this at the expense of our sons and daughters. And today, as we mark the International Day Against Drug Abuse and Illicit Trafficking, it's also a coincidence that we have had very good partnership with UNODC, who have worked with us in many respects. And today, as we celebrate this day, we also cannot fail to celebrate our partners, the many partners we have, led by UNODC. And the head of UNODC is actually one of us, Ambassador Monica Juma. Indeed, this year's theme, World Drug Problem, Persisting Issues, New Challenges, Innovative Responses, aptly captures our realities today. That while drug problem remains persistent, New trends, new substances, new trafficking methods, and new vulnerabilities demand fresh thinking and innovative solutions. Today we are talking about synthetic drugs. We are talking about chemicals that are precursors to some of these drugs. And unlike in the past where we were focusing on ban and just alcohol, there are people who have become more innovative. And even our sons and daughters have become more innovative. You really have to be up to task. You really have to be smart. You really have to be innovative to be able to pick that some of these drug abuses is actually happening, either in our homes, in our institutions of learning, and in many, many other spaces, the social spaces like the one the governor was speaking about. So as a country, like many other countries across the world, we continue to grapple with the devastating effects of alcohol and drug abuse. The latest national data from NACADA indicate that approximately 4.7 million Kenyans between the ages of 15 and 65 currently use at least one drug or substance of abuse. And behind these numbers are broken families, disrupted education, lost economic opportunities, increased crime, mental health challenges, and lives cut short by addiction and substance use disorders. And again, I want to appreciate the leaders here. We have good examples of those who are lost in drugs, who have undergone rehabilitation in this same facility, whom you have supported to come back and have decent livelihoods for themselves, but also for their families. Now, because of this, His Excellency the President declared alcohol and drug abuse a national emergency and directed all government agencies to intensify efforts that are aimed at prevention, enforcement, treatment, rehabilitation, and recovery. And as a ministry that is responsible for internal security, we view the drug problem not only as a public health concern, but also as a significant national security challenge. Drug trafficking fuels organized crime, it undermines social stability, it exposes our youth to exploitation, and threatens the safety and prosperity of our communities. The coast region, owing to its strategic geographic location, continues to face heightened risks that are associated with illicit drug trafficking. I know you're aware of the case of the ship that was supposedly meant to pass through our waters, but with a huge haul of illicit drugs. Today, it is in our custody, courtesy of the multi-agency nature of our security agencies, and we have a court process that is actively going on just to be able to dismantle the criminal networks. And these criminal networks are known to also take advantage of technological advancements and transnational linkage within the region to ensure a steady supply of illicit substances, including synthetic drugs. In the recent years, our security agencies have recorded significant successes in disrupting the major drug trafficking operations across the country. Now, the case that I've just mentioned, which was October last year, what we were able to confiscate was equivalent of 8.2 billion Kenyan shillings. You can imagine what that means in terms of even the disruption of our economy, if at all they were successful. And this came in the wake of the September 2024 discovery of a clandestine methamphetamine lab linked to a suspected foreign cartel. And the facility was located on a 10-acre facility in Namanga, between or just near the Kenya-Tanzanian border, exposing the growing threat posed by locally manufactured synthetic drugs. that as we try to intercept what may be coming into our borders, we also need to be alive to the realities that because of technology, it is possible for people to start producing some of these synthetic drugs locally. And we could easily miss an opportunity to pick such. And these successes demonstrate two important realities. One, criminal syndicates are becoming increasingly sophisticated in their attempts to infiltrate our communities with dangerous substances. And number two, that as a government, we remain vigilant, capable, and resolute in detecting, disrupting, and dismantling these criminal enterprises. Ladies and gentlemen, for continued deterrent, we have strengthened the multi-agency collaboration among security and enforcement agencies, enhanced intelligence-led operations, intensified surveillance along our borders and entry points, and increased efforts to dismantle these criminal networks that are involved in trafficking and distribution of illicit drugs. And I welcome very much the offer by His Excellency the Governor on working together closely with our county security and intelligence teams to be able to deal with these criminal networks. We will continue pursuing the traffickers, their financiers, the manufacturers, distributors, and those who profit from the misery and suffering caused by drugs. We will not have a haven for drug traffickers and their collaborators. So while enforcement remains critical, it is only one part of the solution. We recognize that sustainable success can only be achieved through a balanced and comprehensive approach that prioritizes prevention, early intervention, treatment, rehabilitation, and social reintegration. If you saw the membership of the board, it actually cuts across. Faith-based institutions, the religious organizations, have a role to play. The scouting community that is responsible for helping build or instill discipline in our youth, and all those who are involved, the leadership, the families. As a government, there is only so much that we can do. Our institutions of learning have a role to play. And I remember 2 years or so ago when we had the demonstrations that some of Kenyans were commemorating yesterday. Some of the young people that we took into custody, their parents will come and they tell you that my son, my daughter has not taken his drug. And on further interrogation, you realize that most of those young people were already hooked into drugs. So you see people on the streets, and most of them do not even know why they are on the streets. A good number of them is on account of having been hooked into drugs. They are taking some of these drugs that we are talking about, and because of the excitement, they end up on the streets, and in the process, we end up with loss of lives, loss of livelihoods, and even desperation on the part of parents. And therefore, it is the responsibility of all of us, as parents, as families, as educators, as religious leaders, to support the government in ensuring that we actually not just deal with enforcement or dealing with the criminals, but also to do a lot in the early chain or early value chain of this whole process. Early prevention, early detection, and when we have cases, then we must also work towards rehabilitation. And once we rehabilitate, we must be able to reintegrate, because there are certain cases that it becomes very difficult when the communities look down upon some of these cases that we are dealing with. And the chair of NACADA has given us a good example of what they are doing beyond the rehabilitation work. We had the national essay writing competition for secondary school learners, and this competition has become an important platform for understanding substance use challenges from learners' own perspectives. The essays submitted by students from across the country provide valuable insights into the realities that they face, including peer pressure, mental health challenges, accessibility of substances, social media influence, and the protective factors that help them to remain drug-free. And now, if you look at some of the developed countries, they are even restricting use of social media for children of a particular age. And maybe as a leaders, I would want to encourage and challenge you, maybe it's high time as a country we also followed suit. As I close, ladies and gentlemen, the challenge before us requires a whole of government, a whole of society response. I therefore call upon the parents, the guardians to remain vigilant and actively engage with their children. I want to reiterate or urge our schools, our institutions, the religious institutions, the community organizations, and the private sector to strengthen prevention efforts as we create safe environments that protect our young people from drug use. I want to once again also call upon the county governments across to emulate what Mombasa County is doing, to continue to partner with NACADA and other stakeholders in implementing community-based prevention, treatment, rehabilitation programs that respond to our local realities. Actually, as part of this initiative that is being spearheaded by His Excellency the President, we want to put up one rehabilitation facility in each and every county. Already 11 counties have given us parcels of land where we'll put up the rehabilitation centers, and we will, once we set them up, we will request the counties to take up the responsibility of running those facilities for the betterment of our societies and communities. I want to urge every Kenyan to take personal responsibility in reporting drug trafficking and supporting prevention efforts within the communities. And as we mark this year's IDADA 2026, let us remember that every life saved from addiction strengthens and doesn't weaken our nation. Let us commit ourselves to innovative responses, stronger partnerships, and sustained action against the evolving drug threat. Together we can build a Kenya where young people are healthy, productive, and empowered to contribute